Well, I'm really excited about our practice in Stafford. We are a specialty veterinary hospital and we specialize in orthopedic surgery. So we basically will see dogs from other referring veterinarians. So your general practitioner who treats your dog for all the different things that you take your dog or cat in for will oftentimes see an orthopedic problem, but they won't have the equipment or the expertise to treat them, and so they refer them to us. When I was a young child, I used to spend a lot of time at my grandparents, and they were big animal lovers, and they would go to full extent to make sure their pets got the best care, and that influenced me greatly. So I really developed my desire to become a veterinarian when I was about 5 or 6 years old. And then when I saw them go from the Washington, D.C. area all the way up to University of Pennsylvania to get certain things taken care of, I became aware that there are experts in the field. So I am an expert in orthopedic surgery, as well as my partner, Dr. Stephen Jones. And what we do is we act as an extension of your referring veterinarian. We see cases that are referred by them to us. We make the diagnosis and apply the proper treatment. So we do a lot of different types of orthopedic procedures. We do fractures, of course, and those are always surprise things that people, aren't anticipating, and we do that on an emergency basis or on an as-needed basis. But we also do a lot of orthopedic conditions affecting joints. The most common would be a cranial cruciate ligament tear. In people, this is known as an ACL tear. Probably 75% of the injuries I treat are ACL tears in dogs. And it's very important to diagnose these early and treat them early. If we don't diagnose and treat early, these dogs will develop arthritis that will be with them forever. Other things that we see are hip dysplasia. Today we're going to do a total hip replacement, for instance, to treat that. And this procedure is identical to what they do in us, in man, when we have hip problems and they replace our hip joint. The hip replacement surgery usually takes between 1 and 2 hours, and this depends on exactly what we're going to do in the surgery. But it's a very, very low pain type of procedure. These dogs will walk the day of surgery. Within 2 hours after surgery, they'll start using the leg. The best thing about total hip replacement is it returns their hip to normal function. These dogs are allowed to use that leg as if they had a normal hip. They can return to athletic events. I've had these dogs go back to agility, different field trials, all sorts of different sporting activities. It's made to last a lifetime. We look forward to seeing you at H-Town Veterinary Specialists. We will treat your pet just like we would treat our own personal pet. We will treat it with the highest level of expertise, the highest state-of-the-art medicine and equipment.